Whenever you're ready.
Okay. Hi, Team East Bay. This is Daniel. I'm going to do an Affixus video for you to give you a basic rundown of case with anybody at John Muir. So first up, we're looking at the entry point at the greater troch, and you have a few different options. One and all, by preference, guide wire, and then 2 opening reamers, your standard tissue protector. So by preference, ask the doctor what they're going to use. Either pull out the awl or get the opening reamer set up. Kalafi will use the 8mm gold tip opening reamer. Everybody else is going to use the standard opening reamer. Standard tissue protector will be used with any of those opening reamers. And of course your pin, the pin is going to be open, it's sterile, 3.2mm pin. And then we go to the next step. You should open a 100cm long guide wire. On that, you'll put this pistol grip down the black side of the long guide wire, crank it down, set it aside, and when the doctor's ready to use it and the canal is open, shove that down your canal. Your measure for a long nail is here, and if you're doing a short nail, this is irrelevant. Your nail is going to hook to your jig. You have a jig bolt, and mind you, the jig bolt is something that you have to have for every case. Make sure it's there as soon as you open the trays. You have a hammer pad, hammer, and your 2-piece driver for the jig bolt and nail. Okay, so we're attaching our nail. Jig bolt's going down the top of the jig. Your hammer pad, when the jig and everything is together, just note the orientation. The curve flows in line with the jig itself. And of course your hammer.
Show the bolt.
Sorry.
Yeah.
It's a hexalobe head.
Good.
Okay, once the jig and everything's connected to the nail, I recommend, and most surgeons prefer this, that you grab your sheath and trocar, don't drop your trocar, and make sure your feet of this gold trocar are pointed down toward the patient's feet, just like so. And you can pull this pin out. Some of the guys will do this. I think Wendy's one of them, where she actually likes to pull out the trocar and run the pin through the nail because she's had some issues with synthes. So this locks into place just so everything doesn't fall out by twisting that locking knob. Once you've tested that, everything looks good. She's gonna put the nail in using the hammer pad and the hammer. Once the nail's in, we're gonna grab that sheath and trocar, put in our long pin, and you will use the same pin that you used at the greater troch. Okay, so that same pin will go through your sheath and trocar. And to measure, please move the foot of the pin sleeve over and slide your measure so the feet of the measure hit the outer sheath. It cannot hit the pin sleeve or the measurement will be inaccurate. So the outer sheath. There's your measurement. Now it's time to drill. So after you've measured, simply push this button. It's already loaded on the drill. It's not something you add separately. The arrow is pointing to the length. So just set that up at the length and drill.
Show them, put it through the guide.
Yeah. Okay, and our drill, go through the guide, and it's going to hit this stop.
Mm-hmm.
Okay. So once we've drilled, we will use the appropriate lag screw with a 2-piece T-handle, in which you insert this long rod, which will now lock onto the back of the lag screw and keep your lag screw and T-handle together. And that will be inserted through the gold sheath, which is left behind in the jig after you've drilled, and turn until your lag screw is seated. You need to make sure your black handle is either inline or perpendicular to the jig, so you can now set the set screw that's already preloaded within the nail. Once that set screw...
Compression.
Here's your compression wheel. This can be added on after your lag screw is seated. I recommend doing that so it doesn't fall off as you're inserting the lag screw. So now if the compression is desired, just slide this little gold wheel on the T-handle and turn clockwise.
Okay.
Get your compression. And now we want to set our set screw, which will be this floppy driver. It's a ratcheting black handle that goes down the top of the jig like so. Just turn clockwise until the set screw is tight, and if the surgeon wants to make sure they get active compression, just back off a quarter turn and pull out. So at this point we're looking at the distal screw. The distal screw is going to depend on whether you're doing a short or long nail. So we're going to pretend we're doing a short to start.
Do you want to do anti-rotation now?
Yeah, actually we'll skip that and go to the anti-rotation and come back to the distal screw, which will be everything blue. You'll notice color coding blue on the jig and blue on the sheath and trocar. As we mentioned before, the gold sheath and trocar, these feet are pointing down, whereas the feet on the blue sheath and trocar will be pointing up, away from one another. So here you have two options. You can pull out the trocar and put a provisional pin through the pin sleeve left behind, or you can pull out the pin sleeve and drill immediately.
Which we open.
We will open this AR lag screw. It comes sterile, and when ready, you drill and measure right off of the back of this drill sleeve. Once you have your measurement, pull out, and we're going to use the 2.5 hex or 3.5 hex screwdriver that have a blue and green marking on the back. That indicates it will work in conjunction with your AR screw or distal screw for a short nail. And insert your lag screw. This can go on power to start, and then typically switch to the black ratcheting handle to finish seating the AR screw, and you're done. So if we're working on a short nail and we need a distal screw, we're now switching to the green sheath and trocar, and that goes through either a dynamic or a static slot noted on the jig there. So that's surgeon preference. Put it in the appropriate slot for dynamization or static locking. So once we're down to bone, trocar comes out, and need to make sure you've opened already a green 3.8 long sterile drill bit, and that drill will be inserted through the drill sleeve left behind. After the trocar is out, you now drill, measure right off the back of your drill sleeve. That comes out, and the drill sleeve will come out just the same. And we are going to use the same driver we used for the AR screw. Again, green and blue back. Is going to put in the same distal screw, and you're done. So your distal screw is now in, but let's say we did a long nail. You have what I keep in the trays, a short 4.3 CM nail drill bit. It's shorter than the short drill bits that come sterile as an option with the set. Worst case, if that's not in there, just open a 4.3 drill. But you should find this in the tray. A short 3.5 hex driver, and a 2-piece depth gauge that simply just you rotate until it falls together and it's ready to go. So this will go on power directly. AO Connect, they'll freehand this 3 or 4.3 drill on power, and once their hole has been created, they're going to measure, and from measurement, usually by hand or power, to start and finish by hand, this standard 3.5 hex driver. A couple surgeon preferences. Dr. Wong is going to want this 3-piece locking screwdriver, which is our solid lock driver. It comes in 3 separate pieces. So a little hex tip driver, you throw down hex first down the back of the black handle, chase it with this black knob. I always tell the tech, turn it a few times to make sure it doesn't fall apart, set it aside. When you're ready to use it, the screw is open. Just insert the screw on the top of this driver, crank this down, tight as they can, and test it by pulling on the screw. If it's locked, great. Give it to the surgeon so they can now insert that screw into the femur.
For
Again, this will
distal
be-
long nail screws.
And that's mainly for Dr. Wong at this point.
Mm-hmm.
One other option she likes, you'll find this down with the gold instrumentation for the femoral lag screw, is this black little tube which has a cannulation to it for the 3.2 femoral pin. Every time you typically drill into the femoral head, that pin wants to come out with the drill. So
Show it.
So this pin is left behind after it's inserted into the femur. So now the pin sleeve comes out. The drill goes in. And probably 90% of the time, 80% of the time, this pin comes right back out with your drill. So there should be a little piece of the pin sticking out of the drill. If there's not, you can use your pusher to get it out. Once you pull this pin out, your sheath is still in place. All we're doing is taking this black tube, shoving it into the hole you just created, and putting your pin right through that black sleeve, which centers the pin automatically in the femoral head for you, takes all the guesswork out of it. And now you just pull your sleeve out and you're ready to put in your lag screw. That's it. You do have a simple pusher, which some of the surgeons like to use for both the femoral pin and if you're drilling or reaming for a long nail, to put that down the back of power to keep the long guide wire from coming out as you're pulling the reamer out of the femur. So this pusher is also in the trace.